Stop what you are doing right now, because what I am about to tell you could literally save your life or the life of someone you love. There is a virus spreading right now that most doctors are not discussing in their waiting rooms, that most news channels are barely covering, and that is quietly sending people, especially adults over 60, into intensive care units with almost no warning at all. It is called Hantavirus. And today, I'm going to tell you exactly what it is, how it gets into your body, what it does once it is inside you, and the 5 things every adult over 60 must do this week to protect themselves. I'm Dr. Markus Dexter, a physician and researcher who has spent decades studying how diseases affect the aging body differently from younger bodies. Here's what you need to understand immediately. According to data published by the Centers for Disease Control and Prevention, the case fatality rate of the most dangerous form of hantavirus, a condition called Hantavirus pulmonary syndrome, sits between 38 and 50%. Nearly 1 in 2 people who develop the severe lung form of this disease do not survive it. And adults over 60, whose immune systems have naturally declined by up to 60% compared to a 30-year-old, are among the most vulnerable people on Earth to this virus right now. Stay with me. We are counting down from 5 to 1, and number 1 is the piece of information that could make the difference between life and death. Almost no senior is doing it, and the reason why is going to surprise you. Before we go further, tell me in the comments right now, have you recently been near a cabin, a storage shed, a barn, a garden space, or anywhere that might have had mice or rodents? Drop your age and your answer below. I read every single comment, and your answers shape what I cover next. Think of your body as a city and your immune system as the police force protecting every street corner. Now imagine a threat so small and so efficient that it slips through a ventilation shaft, bypasses every checkpoint, and goes straight for your cardiovascular and respiratory systems. That is hantavirus. It is carried primarily by deer mice. The rodent itself almost never gets sick. It simply sheds the virus continuously in its saliva, urine, and droppings into the environment silently and with no visible warning signs whatsoever. In North America, the primary strain is called sin nombre virus, first identified in 1993 during an outbreak in the Four Corners region of the Southwest, where a cluster of previously healthy individuals died of a mysterious respiratory illness that baffled physicians. In South America, a strain called Andes virus carries the terrifying distinction of being the only known hantavirus strain capable of spreading directly from person to person. Now here is what makes this uniquely dangerous for anyone over 60. After age 65, your mucociliary clearance, the system of tiny hair-like structures lining your airways that trap and sweep out foreign particles before they reach your lungs, declines in efficiency by approximately 30 to 40%, according to research from Johns Hopkins University School of Medicine. What a 35-year-old might partially clear before it reaches the deep lung tissue, a 68-year-old is far more likely to have reached the alveoli, the tiny air sacs deep in the lungs where hantavirus does its most devastating damage. You have less biological margin than you think, and the window between first symptoms and respiratory failure is measured not in days, but in hours. The primary route of infection is inhalation. You breathe it in. When infected rodents urinate, defecate, or shed saliva in an enclosed space, a garage, attic, basement, cabin that has been closed for the winter, a garden shed, even the inside of an old car, the virus particles attach to tiny dust particles and become aerosolized. When you walk into that space, when you sweep up droppings without protection, when you move boxes that have been sitting undisturbed for months, you inhale those invisible particles. Research published in Emerging Infectious Diseases found the virus can remain viable in cool, dry, sheltered conditions for several days or longer. Once inside your body, the incubation period ranges from 1 to 8 weeks, with most people developing symptoms 2 to 4 weeks after exposure. This long silent window is one of the most dangerous features of this virus. You can feel completely fine with no idea a storm is building inside you. The illness begins with what feels exactly like the flu. Fever, fatigue, muscle aches in the thighs and back, headache, dizziness, sometimes nausea. Most physicians not specifically looking for it would assume influenza or COVID-19. Then, within 4 to 10 days, the disease enters the cardiopulmonary phase. This is the phase that sends people to the emergency room. The blood vessels in the lungs become increasingly leaky. Fluid floods the air sacs. Oxygen levels plummet. Blood pressure drops. The heart begins to fail. Hantavirus pulmonary syndrome can progress from the first sign of breathing difficulty to complete respiratory failure in as little as 24 to 48 hours. Many patients require mechanical ventilation within a single day of their breathing becoming compromised. There is currently no specific antiviral drug approved to treat hantavirus. Treatment is entirely supportive: oxygen, mechanical ventilation, fluid management, and time. Prevention is everything, not next month. This week, check your garage, basement, attic, garden shed, any outbuildings, your crawl space, and any vehicles that sit unused for extended periods. You are looking for droppings, small dark grains of rice, gnaw marks on wood or packaging, nesting materials made from shredded paper or insulation, grease marks along walls where rodents travel repeatedly, and the distinctive musty odor of an active infestation. Do not bend down and inspect and enclose spaces without protection. Open all doors and windows first and let the space air out for at least 30 minutes before entering. Research from the University of New Mexico found that nearly 12% of deer mice trapped in rural areas of the American Southwest carry sin nombre virus. That is roughly 1 in 8 mice, a walking biological hazard. And after age 70, your innate immune response, the rapid-fire first responder system that attacks pathogens before your adaptive immune system even mobilizes, fires at roughly 40% of the efficiency it had when you were 40. Synergy tip: do this audit in pairs. Bring another person with you so that someone knows where you are and can get help quickly if you feel any respiratory distress in an enclosed space. When you enter any space with evidence of rodent activity, you must wear an N95 respirator mask, not a surgical mask, not a cloth mask. A certified N95 that creates a tight seal around your nose and mouth and filters out at least 95% of airborne particles. A standard surgical mask allows air to flow around the edges and provides essentially no protection against aerosolized hantavirus particles. You also need disposable nitrile gloves to protect your hands from direct contact with droppings or nesting materials. If the infestation is significant, old clothing that you can immediately bag and wash in hot water is advisable. I know this sounds like a lot for a trip to the garage. Consider this: the protective equipment costs approximately $15 to $20 at any hardware store. An average ICU stay costs between $3,000 and $10,000 per day, and no amount of money buys back lung function lost to hantavirus pulmonary syndrome. After age 75, your body loses approximately 35% of its pulmonary reserve, the extra breathing capacity that kicks in when your lungs are under stress. You have less margin than you think. Pre-ventilate before entering. Open all windows and doors and allow fresh air to circulate for at least 30 minutes. This dramatically reduces the concentration of aerosolized particles in the air before you step inside. If this information is already making you think differently about spaces you enter every week, hit the like button now and subscribe. I release evidence-based health content specifically for people over 60 every single week. Steps 3, 2, and 1 are the most critical of the entire list. Stay with me. This is the one I see people get dangerously wrong almost every time, and it is the mistake that turns a manageable exposure risk into a potentially fatal one. Never dry sweep, never dry vacuum, never use a leaf blower to clear rodent droppings. These actions aerosolize virus particles and create a cloud of infectious material you will inhale directly into your lungs. Instead, the CDC recommends a specific protocol. Wet the area thoroughly with a disinfectant solution, either a commercial disinfectant or 1.5 cups of household bleach per 1 gallon of water, and let it soak for at least 5 minutes. Then, while wearing your N95 and gloves, use paper towels or disposable cloths to pick up the dampened material and place it immediately into a sealed plastic bag. That bag goes into a second sealed bag and is disposed of in a covered trash container. Wipe down all surfaces where rodents have traveled with the same bleach solution. Mop hard floors, steam clean carpets if possible. This wet cleaning method prevents virus particles from becoming airborne and cuts your exposure risk by an estimated 90% compared to dry sweeping, according to guidelines published by the New Mexico Department of Health. For your aging immune system, this is not optional technique. It is the difference between walking away unharmed and ending up on a ventilator. The window between the beginning of symptoms and the point of no return in a hantavirus infection is measured not in days, but in hours. Knowing what to look for and acting immediately is the difference between survival and not. Here's the specific combination of symptoms that should send you to an emergency room right now. Not urgent care. Not your primary care physician's office 2 days later. An emergency room. Fever above 101 degrees Fahrenheit combined with muscle aches, especially in the large muscle groups of the thighs and back, combined with progressive shortness of breath that worsens over hours, even if it feels mild at first, in someone who has had any potential rodent exposure in the past 1 to 8 weeks. That combination is a medical emergency, and when you arrive, you must tell the emergency room physician specifically and clearly, "I may have been exposed to hantavirus. I was near rodents. Please test me." Do not assume the physician will connect the dots. In a busy emergency room, hantavirus is not the first thing on anyone's differential diagnosis. You are your own most important advocate in that moment. Research published in the Annals of Internal Medicine found that patients who communicated a potential hantavirus exposure history to their treating physician within the first 24 hours of respiratory symptoms had dramatically better outcomes than those whose exposure history was identified later. After 65, a phenomenon researchers at Stanford University call inflammaging means your body may not mount the early warning signs of illness as clearly as a younger person's. You may feel less sick than you actually are. Take symptoms seriously. Act fast. Every hour matters. Number 1, the single most powerful thing every adult over 60 must do this week, and almost nobody is doing it. Have a direct, specific conversation with your primary care physician about your hantavirus risk profile. Before you clean, before you go near rodent-prone spaces, and before the summer rodent season peaks. A 2022 survey conducted by the American Geriatric Society found that fewer than 8% of adults over 65 had ever discussed zoonotic disease risk, diseases transmitted from animals to humans, with their primary care provider, fewer than 8%. Here is why this conversation matters so much. Your physician can do something that no amount of bleach or N95 masks can do on their own. They can assess your individual immune status. They can review whether your current medications, antihistamines, corticosteroids, certain blood pressure medications, may be suppressing your immune response in ways that make you even more vulnerable. They can note your risk profile on your chart so that if you arrive in an emergency room with respiratory symptoms, the connection is made immediately. And they can flag you for priority testing and transfer if you do become ill. There is no vaccine for hantavirus. There is no antiviral you can take as prevention. But your physician, properly informed, becomes your early warning system and your first line of defense if you do get sick. Print out the key points from today's video. Walk into your appointment and say, "I want to talk about hantavirus risk. I live in or visit areas with rodent exposure. What should you know about me in case I get sick?" That conversation, for a 68-year-old woman in rural Colorado or a 74-year-old man who summers in a cabin in New Mexico, could be the conversation that saves her life, or his. Synergy tip: combine this physician conversation with the rodent audit from Step 5. Walk into that appointment with specific, concrete information about your actual exposure risk. An informed patient is taken far more seriously and gets far more useful guidance than one who comes in with a vague concern. Tell me in the comments, have you ever cleaned a space with rodent droppings without protection? And which of these 5 steps are you taking first? I read every single answer, and your responses shape exactly what I make next. Here is what I want you to take away from everything we covered today. You are not helpless. You are not at the mercy of this virus. You are an intelligent adult who now has specific, actionable knowledge that most people, including most of your peers, do not have. You know what hantavirus is and how it spreads. You know what it does to the body and how fast it escalates. And you know the 5 things you can do right now, this week, to dramatically reduce your risk. Do the rodent audit, get the N95 and the gloves, learn the wet cleaning protocol, memorize the symptoms that demand immediate emergency action, and have that conversation with your doctor. These are not complicated steps. They are not expensive steps. But they are the steps that separate people who are protected from people who are not. The ability to open your own cabin in spring, to clean your own garage, to putter in your garden shed on a Saturday afternoon, these things matter. They are the fabric of a full, active life in your 60s, 70s, and 80s. And it is absolutely not too late to protect that life. It does not matter if you have been cleaning spaces without protection for years. Starting now, with the information you have right now, you can change what happens next. If this video helped you, share it with one person today. A spouse, a sibling, a neighbor, a friend with a cabin. That share may be the most important thing you do today. Subscribe for more evidence-based health content every single week, specifically researched and designed for adults over 60. I'm Dr. Markus Dexter. Stay informed, stay protected. I will see you in the next one. This video contains general medical information based on published research and clinical experience. It is not a substitute for personal medical care. Never change or stop your medications without consulting your physician. Always speak with your healthcare provider before modifying your supplement routine, especially if you are on prescription medications.